Here's our mama Peace and her baby Cyprus. Cyprus is 2 weeks old as of yesterday. He's a healthy baby boy. He's growing, right on track. However, the one issue that we have is that he actually has an umbilical hernia. That's a new thing for us. We haven't had any babies be born with an umbilical hernia before on our farm. I did notice ever since birth that his navel was protruding more than the other babies that we've had, and I kind of waxed and waned on it, and I was wondering, like, is this a hernia? I'm not really sure, and I continued to watch it, and it hasn't closed up yet. So I started doing a bunch of research on it, and I also contacted our mentor as well to ask some questions. So we decided to make a homemade band just out of some Coban. This is a self-adhering type of medical tape. And then I also have this surgical dressing, which is just kind of a puffy dressing. The reason I'm going to use this is because I want to have a little bit of pressure where that hernia is to keep it tucked inside. So basically an umbilical hernia means that where the umbilical cord was, it did not close up. The abdominal wall is still open and a little bit of intestines are protruding through that opening. So if that opening closes up with the intestines sticking out, that becomes like a surgical emergency basically. So one of the things that we've been doing lately is that multiple times a day I come out here and I squish the intestines back up inside that hole. That's one of the things that I read online that you can do, and hopefully that would just keep it up in there and the abdominal wall would close naturally. But for us, the intestines just immediately pop right back out. So that's not really working for us. So I'm going to make a homemade band today, and like I said, how this is going to go, he's probably going to get buck wild as I'm trying to apply this band. So I'm going to go ahead and rip off a bunch of Coban so that I'm ready. And it is self-adhering, so you gotta kind of keep it from sticking to itself. So I used to be a nurse. I love using this part of my brain, although it's been a long time since I've been a nurse. I actually haven't been a nurse now for more time than I was a nurse, but all of those skills still live within my brain, and when I'm working with the alpacas, it amazes me what I remember. Most important thing about nursing and raising animals is having critical thinking skills. You know, observing what's happening and then knowing when the time is right to provide the animal with an intervention. Hi, buddy. I'm going to rip off a second piece of Coban. This Coban is skinnier than the other one, but I have more of it. Okay, so let's see how this goes. I'm going to put my supplies right here. Actually, I'll put them in the order that I need them. So more like that. And I'll grab this baby up and see how it goes. Come here, buddy. So I'll hold him between my legs. And yeah, I can feel this squishy belly button. Pushing it all the way up in there. Grab my surgical dressing. And see, it's already back out. So I'm going to need to keep the pressure on it. Sierra. I'm actually going to spin him around. Gives me more control. That's a good boy. That's a good boy. I think that did the trick. Hi, buddy. Hi, buddy. So, one of the things our mentor said is that when you do a band on males, you have to keep a close eye on it because they will pee on it, so it needs to be changed more frequently than on females. And you also have to be careful that it's not too tight, because then you would maybe be making it hard for them to breathe or decreasing the blood supply to that area of the body. But it also needs to be tight enough to hold in that little bit of intestine that's protruding out the abdominal wall. So I think that I did a good job by using that surgical dressing as like a pressure dressing to kind of keep that in there. So I'll have to monitor him. His mom's like, "What the heck is on you, baby?" But he seems fine. Don't forget to subscribe. Thank you for your support.